Good afternoon, everyone. I'll be presenting my paper on a novel and inexpensive training model for teaching basic steps of oculoplastic surgery. So we all know that ophthalmic surgical training has a steep learning curve where large numbers are required for increasing stepwise surgical competence. And the Halsted's model of see one, do one, teach one, there the patient safety is at risk along with ethical concerns. We do have wet lab and simulators as training model, but nothing specific for the oculoplasty procedures. And there are some must-know procedures that are present there for the residents and the general ophthalmologists. So the aim of the study was to assess the utility of pig head as a potential surgical training model for surgically naive trainees for practicing basic steps of oculoplasty like upper lid entropion surgery, evisceration plus minus implant, and lid margin tear repair. So the methodology involved procurement of the pig head from the ablator, establishment of the surgical workstations in the already present wet lab, didactic lectures and video demonstration of the surgical steps to the trainees, and step-by-step guidance and supervision by expert oculoplasty surgeons to the trainees. But how to assess the performance? So we had divided all the steps of the surgery into cardinal steps. Like you can see for upper lid entropion, it involved traction sutures, tarsoconjunctival incision, dissection, and then the everting mattress suture. And similarly, this was the response of the training. And similarly, further surgeries were divided into their cardinal steps. The upper are the human eyes and the lower are the pig eyes. So this was similarly done for the lid margin repair. So how to assess subjectively? We developed a Likert scale-based questionnaire. One was for the mentors to evaluate the trainees, how they are performing the step, whether they had any difficulty in performing or could not perform at all. And for the trainees, we had for the tissue feel, improvement in skill and understanding of the surgical steps. And for the objective assessment, especially for the entropion correction surgery, we had a surgical competency-based rubric which was vetted and validated. It consisted of 5 key steps of surgery and 5 global indices based on the modified Dreyfus model with numerical tracking and descriptive narratives. The scoring of the performances of the trainees was done, and we also had translation to OT, where 3 of the participants performed the surgery on real patients, and the same rubric was used for performance assessment. So we had 18 participants, which consisted of residents and ophthalmologists. 83.33 had neither observed or assisted these surgeries. And this was the performance-based assessment where the steps had been performed by the, this is the subjective performance assessment. So here you can see the performance of all the participants for entropion correction, for evisceration plus minus implant, and for the lid tear repair. So the validation process, the median score was 4. In the participants, they achieved a score of 3, and in the OT, they achieved a score of 4. They also overcome the various hurdles, and 100% participants felt that the practice improved their surgeries, and 95% almost felt that they had a better understanding of the surgical steps. So this can form an ideal model because of the similar anatomy, easy storage and acquirement, inexpensive and low risk of disease transmission. They have been previously used for some oculoplasty surgeries and for glaucoma and cataract surgical training. The advantages of pig model are they are affordable and available, and they have a larger size compared to other animals. Our participants also felt similarity in the gross anatomy, and also in the tissue maneuvering, and the texture was similar. Compared to the human eye, there are multiple differences, but the skin being thicker can be managed with the help of larger free cutting needles. There is no bony orbit that is present. There is a semilunar fold of skin and the presence of the retractor bulbi muscle. So I would like to conclude that the porcine model is affordable, usable, and achievable even in a resource constrained training environment, recommended for early training, and it can improve the anatomical understanding, clinical judgment, and surgical efficiency. And also this rubric of upper lid entropion can be used for future application and be utilized for assessment of the trainees. Thank you so much.
Thank you, madam.
These
It's
are
a
my
novel
references.
idea to train our younger doctors in oculoplasty segment, because we all realize that problems are on rise where services of oculoplastic surgeons are required. So, any other comment from you?
Very nice way of teaching and training.
Thank you,
So
ma'am.
who are the participants? Like they are the residents from different parts of
Ma'am,
your,
they were
or
the
your own
residents,
students?
DNB residents from our institute, and also the participants. We had conducted a workshop where these general practitioners were invited.
That's my question, because you have mentioned that performance have increased, the performance percentage has increased.
Yes.
So how do you monitor the efficacy of this increased performance in those residents who are not from your institute?
Ma'am, we have
Because
not
overall
yet,
percentage you have shown quite high.
ma'am, so that was the surgical stepwise performance. So where we
Now
have
once they
taken
have
this-
gone back and started on human, tissue.
Ma'am, we had that subjective questionnaire. So there
Okay.
it was on the Likert scale base. So the steps that they have performed without any difficulty, that percentage has been incorporated into the graphs that I've depicted.
Thank you.
Thank you.